technically what it really means, we looked at 2009, 2010, 2011. We looked at the third quarters, and we looked at the figures. And we looked at the figures of the number of patients that were admitted. The figures were more or less consistent. They range in the region of about 5,500 patients that were, these were total deliveries. So we had about 5,500 total deliveries, right? We had a number of stillbirths, which is expected in any institution, and we looked at the percentages over the 3 years. The percentage for 2009 of stillbirths against the total deaths is approximately 2.7%. The first one was 3%, then went to 2.7%, and in 2011, 2.8%. Right. So even though there's been the difficulty around highly trained specialized nurses, the effect and the impact on the number of stillbirths has not been significantly affected. If anything, it's even less.
Right, there's been some, whether should I say it's neglect or ignorance from our own clinicians. There's just what I would call carelessness. So now we're getting closer to that session to say what is the problem. One of the problems is on our side, of course, and we're going to correct that. But on the other side is that in Bara, we discovered through putting that system that we had ghost doctors. So Dr. Ntombi Mekgwe was there, and when you check in our system, we don't have such doctors, and we're expected to pay. That's why this thing of the dispute comes from. So then there's an issue of the theatre, because it has been widely reported that our theatres are not working, babies are being killed, patients are being compromised. What I want to indicate is that, yes, we agree, we acknowledge a fact that we are having a shortage of nurses, generally in South Africa, not only in Bara or in Gauteng. And the issue of saying that we never allowed people to employ staff is not true. What we said was that critical staff members must be employed, but those unnecessary posts must not be filled. If you look at our personal budget, it is frustrated by the staff that we employ, whether those people will need them or not. We're still verifying that information. We'll be doing a staff audit later in the month, but also a skills audit, so that we verify as to whether those people that we say, the 69,000 staff members that are employed by the department, are they there, so that even these ghost doctors must not only remain with the doctors, we must check everybody, including, even a cleaner and everybody else.